Hello students, we will discuss today not a case discussion only but traumatic case discussion. So what this injury or trauma is. Now look at this, hand is there, lengthy transverse incisor wound, that is hand injury. So how we will classify hand injury like tidy, untidy, and what are the structures comes. You got all those tendons are there and which tendons are involved, not involved. So proper clinical examination for each tendon, flexor, digital superficial, cephalon profundus, and thenar muscles. So vessels, nerves, sensation, everything you have to check. Muscle movement, joint, vessels, perfusion, everything you have to check because very complex area hand is. And finally, at the end of the day, you have to get proper functioning hand to the patient. So this is the idea. So you have to remember this hand is a deep incisor wound. So you have to remember classification, tidy, untidy, compartment, deglowing, indeterminate injuries. It's how it is classified. What are management principles? These are the management principles. So you have to assess. I have told already to initially to manage tourniquet and hemostasis is required, and tetanus toxoid, ETG, and tetanus globulin has to be given. Imaging of the hand is important. Currently, of course, our ultrasound. Ideally, MRI of the hand has to be done. Now, my MRI is available in most of the centers. So, if radiologists are available, immediate MRI can be done. Otherwise, at least Doppler study or ultrasound and X-ray should be done. And primary suturing whenever feasible. Delayed primary suturing if there is edema and lacerated wound, crushed injuries. And reconstructive procedure later or the same time, depending on the availability of the reconstructive surgeon, or depending on the feasibility, depending on the condition of the patient, and depending on the tissue, how bad it is. So if it is untidy wound, you can't do the reconstruction same time. You have to wait everything settle down later. Delayed reconstruction, you have to sometimes you have to do tendon transfer, sometimes you have to do vascular anastomosis, sometimes you have to put a plating for the small bones. So it is many times it is a management of hand injury, is a staged procedure, not single setting. Do something here, then initially damage control surgery, something like that. Then eventually you do a proper procedure step by step in the involvement of the plastic surgeon or reconstructive surgeon. So hand injury is a major problem and difficult to manage, requires a teamwork, a proper assessment, and finally staged procedures required, and finally good functioning hand should be the target or motto of when you are treating the hand injury as such. And this is the one you have to remember. Modified Verdun zones. There are zones, zone 1, zone 2, 3, 4, 5. Zone 2 is this one. Zone 2 in between this area is called no man's zone or critical zone. So whatever injury occurs in this area is very, very difficult to manage and it causes unless you treat properly, meticulously, causes disability. So zone 2, all this Verdun zoning, it is often asked as MCQ question, Oxy they will ask, and Y also they may be asked. So neat exam also it may be asked. So you have to know what are the zoning, Verdun zoning in hand, and which zone is most critical. No man's zone is zone 2. Zone 2. That is the point which you have to remember. Critical zone, that is modified Verdun zone in the hand. That point you have to always remember. So students, it's about hand injury basic. Hand is very complex structure. Hand infection is also very important. And hand disease is also very important because it's a very most active, dynamic, functioning structure is the hand. So you can read about how to examine different hand nerve injuries, hand functions. Different tests are there. You can go through my clinical method in surgery, my hand injury details. You can go through my manual of surgery and surgical principles. You can go through my uploaded surgery and detailed lectures to DigiNow through JP Publishers. My surgery lectures are there. Always you can purchase and go through that for the clear idea. So students, I hope basic about hand injury you understood very well. Thank you very much.